And I'm just going to introduce, our chair, and then Rudy Page, who can then will sort of take from there. So just a bit around today's event. It's entitled "Shaping Our Futures," focused on health and wellness, and just a bit about Rudy. He's a chief exec officer at Making Connections Work, and is an award-winning mentor and coach. He's worked extensively within the NHS and with Royal Colleges, and he's worked across different systems, focusing on inclusion, public and private engagement. And he's also has a number of trustee and non-exec roles he's held or does hold, including Northwest London Community Foundation, the Chamber of Commerce, RAFA, which is the International Development Agency. He's also been vice chair of the Talawa Centre Theatre, and he's also an active member of the Lions and Kiwanis International Charities. So welcome, Rudy, and welcome to the panel, and I shall hand the baton to you.
Thank you very much for that, Zishan. Great to see you again. Good evening, all. And you're in for a great treat today, I believe. Just to say a bit about my role as it relates to NHS blood and transplant. In fact, this will be the 10th year of association with NHSBT, as we say. And I must thank Torquosi as well, and Dr. Dapper Odemuro. We've all worked very well over the last 10 years on various projects, including the sourcing of 4 mobile blood collection units that have gone to the health systems in the Caribbean. That's Antigua and Barbuda, Grenada, Jamaica, and St. Lucia. And we've also been responsible for a lot of equipment as well, all relating to blood transfusion as well. And it has been a collective effort, you know, coordinated through RAFA, International Development Agency, and we've worked with a number of different diaspora organisations and high commissions, and it's been a great feat of collective action. So it really has set an example of working together. So today's event then is called Shaping Our Futures, Health and Wellness, Thought Leadership and Knowledge Sharing Dialogues. So this symposium brings together individual perspectives for future collective action to reduce the impacts of the pandemic on mental health, economic well-being, youth development and productivity. All of the individuals on the platform this evening have been involved in community activities. They've also been involved in NHS and related agency commissioned programs, and they would be now popularly known as the trusted messengers. And throughout this pandemic, particularly when it related to vaccine confidence, countering misinformation, providing the science, this new group of professionals in and outside of the health system, rooted in the community, are now starting to coalesce into what's going to be an exciting group of people over the next few months. And all of this really stems from some of the work that we thought about. In fact, last year, Richard Davis and myself said that it was important that we take responsibility in terms of collective action. So we did many Zooms around the workforce and the community. So throughout the NHS programs and related agencies like the CCGs, the community pharmacies, we've actually developed the term, the community is the workforce and the workforce is the community. And one of the outcomes from this pandemic has now meant there's a better interrelationship between the community and those of us who work in and around the health systems, which is really has been important for us establishing a way forward. So I'm going to start off with Patrick Ogier as our first speaker. Over to you, Patrick, and thank you.
Good evening, Rudy, and good evening to everybody else as well. I'll just give you a very short few minutes of myself, how I started. I'm really here as being engaged with so many sort of community work and for the community, especially sickle cell disease. I'm here really by default in many, many ways, because it's only really after one of my son was born with sickle cell disorder, I was aware of the lack of knowledge and management in the NHS. I gave up my engineering career to cater for my son and care for my son. And after getting involved really in the local issues and local support group, I really worked on a very wide range of improvement projects, but particularly around specialized commissioning. I'm a former interim of CEO of the Sickle Cell Society, chair of the PPI London's Commission, Specialized Commission Group, NHS England Specialized Commission Clinical Reference Group, and lead in a public and patient forward voice in the West London, what's called HCC Coordinating Centre. This is a network that's just really established and given the go-ahead by NHS England to be responsible for sickle cell, specialized sickle cell treatment. And there's 10 networks throughout the country, and each in a geographic area are responsible for the care for people with sickle cell disease. I'm really engaged with that at the moment because I'm the chair of the patient public group in the West London HCC. And that is really, I think, a remarkable thing in itself, because when the specification for these networks was actually formed, there weren't no public voice, PPV, role within the network. But I really worked hard and work with the director of West London Network, providing a report why it's needed to be there. And that was finally accepted by NHS England on the structure, which is again a remarkable thing. That was the first and only network that had that PPV on the structure of the services for sickle cell disease.
And when you say PPV, it's patient public
voice.
Yeah.
Right. So as being part of the structure, we've got it's very independent, and we have the same really role to play and same sort importance as the clinical clinicians, nurses, and communication. So, and again, if there's any problem, we could escalate any issue up to NHS England so wish.
Right. So if you can take us to this topic around the new drug.
Well, this new drug that's been NICE has really approved of. It's only a temporary approval because still, I think the temporary approval is for about 2 years because they consider it's not enough data for them to assess the effectiveness and the cost effectiveness of this drug. In my experience working especially with London Specialized Commission, that sort of coded message, and it's really basically, I would say, they want to keep the option open because of the cost.
What is it called, Patrick?
Well, it's one. It's funny name. It's chrysanthemum, CRIZANLIZUMAB, right? Okay. And it's been developed by Novartis.
Yeah.
Okay.
And which particular sickle cell patients is it going to benefit now? And what are your views on that going forward in the future in terms of provision?
I think it's an upgrade from a drug which is very wide use, hydroxyurea, again by Novartis. They can't establish exactly who could benefit from drug. It's more or less a trial error. But with this drug, it seems more widely used and accepted by patients. And they expect, really, I mean, it's already proved that it's remarkable in the results so far. But again, I think NICE is trying to best they can. If it's too expensive, have the option. And if there's too many people who demand the drug as well, then again, the cost goes up. I think that as community leaders, we should support the community in trying to, get this drug available, because it's only one of the very few drugs that's been designed for people with sickle cell over the last 100 years.
So the real takeaway then for the community is to understand about the drug, and for it to be more widely available to sicklers to improve the quality of their lives, and for the public, that is our community, to understand it and get behind the campaigns as it relates to that particular.
Absolutely. Yeah. Absolutely, because the data will be widely available, and again, it will be distributed, but again, it goes through an NHS network, so the ordinary people may not be able to have access. So that's where we come in, to able to cascade this sort of information. It will be useful, and it is useful, ensure that it's available. And again, it's just maybe just one, again, another bow in the strings of helping people with sickle cell, because I mean, being a long-term illness, right, and chronic illness, sickle cell disease, really, there's a huge risk, for example, of depression, and that's, I mean, one of the main causes of this is because of chronic pains and the history of sickle cell itself, where up to about 30-40 years ago, patient wasn't deemed to last, so to get to adulthood. Right now, with all the bits and pieces and the improvement of the services, I mean, I met somebody with sickle cell over the last weekend, 82 years of age and still active.
Great. Okay, so we're going to come back to that, and no doubt some of our other thought leaders will take that into consideration in terms of their input. So I'm going to come to Dr. Joan St. John now. Thank you for that, Patrick.
Thank you very much, Rudy. Thank you, Patrick, and thank you for inviting me to be part of the panel. I'm going to build, Patrick, on what you've said, if that's okay. My name is Dr. Joan St. John. I'm a doctor who's worked as a GP for many decades, and now I'm specializing in diabetes, and that, I think, is one of the reasons why I'm part of the panel today. So if I can say a little bit about myself, first of all. So as I say, I've been a GP for many years, not doing general practice now, just only specializing in diabetes. And as such, I'm one of the Diabetes UK, which is the largest charity for people living with diabetes in the UK, and one of their clinical champions. And I decided to use that role. I was one of the first ones, actually. And I decided to use that role to try and help improve some existing health inequalities. And this is going back quite a few years. This is pre-COVID, way before COVID. And the health inequality that I was very aware of as a doctor working and specializing in diabetes was that people from our communities didn't have specific, culturally specific information about the food that they could eat from their traditional foods in terms of how it would affect their blood glucose. So if you were from the wider white community, you could easily get information about foods that you could eat, how they would affect your blood glucose. But if you're from a Black community or a South Asian community or other ethnic minority, that information wasn't available. Now, I'm sure everybody's heard of diabetes, and most people know that it has something to do with food. Well, food is actually fundamental to diabetes. because how can you improve your health if you don't know from your traditional food what food it's okay for you to eat? So I decided to use my time I'm still a clinical champion for them, but I decided to use my time to try and rectify one of those really obvious health inequalities to me. And along with a consultant dietitian, we wrote a book called World Foods. It's available in libraries in Northwest London. We've made sure it's available freely. It's available in different places. We make no money from it. It's not about that. It was about getting that information out there. So today, as it happens, I was doing an event and somebody came up to me and said what a difference it had made. And that was why we did it. A lady, she looked like me. She was Black. And she said that book has changed my life, because she could look at plantain, she could look at yam, she could look at different foods, she could look at rice and see what impact the quantity of food that she was eating. So it's not about not eating the food, but it's about the quantity. And she could look and see easily what impact that might have. Patrick mentioned about the mental health impact of living with a long-term condition. And I think it's so important that we have a holistic view of health. So whether we're talking about diabetes, whether we're talking about sickle cell, whether we're talking about other hemoglobinopathies or different conditions, it's about a holistic view. So you can't talk to somebody who looks like us about diabetes and not take into account traditional foods, the family, celebrations, general living. You can't talk to somebody who's living with sickle cell disorder and not take into account, again, family, and their circumstances. You have to have a holistic view. Now, my view in terms of what we need to do going forwards, like Patrick, is raising awareness of this new medication. I, for my part, in my field of diabetes, want to raise awareness. People know, they think they know about diabetes, but maybe they don't know all they need to know about diabetes. And I want to make sure that everybody has the information that they need and they are empowered to look after themselves better. So that dreadful pandemic that we have and are experiencing will not have the impact on people who look like me and people who are living with diabetes the way it has done over the past 18 months. So I could talk for a long time. I'm not going to do that. I'll leave it there. Just a flavor of how I came to be here this evening and what my hopes are and my plans and aims for the future. And I will, if you will allow me, Rudy, share a link for an event to try and raise awareness of one aspect of diabetes, which is tomorrow. So at some point, if you give me permission, Rudy, I will share that in the chat. Thank you.
Yeah, happy for you to do that. And thank you for that. The reference to the pandemic as it relates to, as we've been driving forward, it's about the public and our community being informed, reassured, so that they can make the right choice. And that goes for everything. And that's why this improved grouping and professional collaboration, which we will be talking about a bit later on this platform, is really important and essential. I'd now like to go to Angela Clark.
Good evening, Rudy. Thank you very much for inviting me, and good evening to everyone on the panel and everyone else who's listening. It's a privilege and an honor really to be here. Really just to share, I suppose, about myself initially, and then maybe to talk about some things that I myself and or the organization RAFA has also been involved with. So I'm a qualified psychologist and practiced for about 22 years. But for the last 12 years, I've been in the area of adult health and social care. As well as that, I am the CEO of RAFA International Development Agency, and it's really interesting when I hear Rudy's the comment that you made about the community is the workforce and the workforce is the community, because definitely for me, and when I go into the office and do my 9 to 5, you know, I am in a different capacity serving as a, you know, serving the public pretty much. But then I walk through the doors at whatever time that is, and I become part of the community. So it's really interesting, and hearing both from Patrick and from Joan, totally agree with both. If I can start with my my day job, as it were, working in adult health and social care, what I have seen over the past 18 months plus, pretty much, is you know, are the effects of the various health inequalities firsthand. I've seen staff being affected, certainly health and social care staff. Some still, you know, really struggling with the effects of the pandemic and what that has brought, not just from the fact of contracting COVID themselves, but also the I suppose the vicarious trauma that they have experienced as a result of that. From my perspective of CEO of RAFA and being involved with RAFA for the number of years that I have been, and certainly you, Rudy, you talked about the work of RAFA and the mobile blood units, and phenomenal work that was certainly achieved. But it's good to know that even today those mobile blood units are still in operation and still doing some good work in the Caribbean. But certainly what my work with RAFA has really highlighted, and certainly, you know, over the last 18 months, I can't believe how busy, you know, even during the pandemic period, how busy it has become, primarily because of the fact that the health inequalities that the minority groups have experienced has been magnified. But it has been magnified, but for many years we have, you know, tried to raise awareness about the health inequalities around the issues of, you know, cancer and, you know, and diabetes and prostate cancer and all of these things. And I remember many years really working with you, in fact, on the Cancer Does Not Discriminate campaign. And the reality is health does not discriminate. And when we see it in all its guises, you know, Dr. John, you talk about diabetes. It was been through this kind of pandemic period that even I myself realized that I was pre-diabetic, and quite surprised me. But what was important was the fact that what I was offered was a program called Healthier You. And in going through that program and the information that I received and education that I received, I was able to reverse it. Mm-hmm. So that kind of reinforced to me how important it is for us to make sure that our communities are given the information, the education, and that we do raise awareness about these issues that affect people. So I realize that we're stuck for time. So what I will say is, in moving forward for me, certainly for RAFA, are maybe I'm going to choose 3 important things, and I know that there are many more, but certainly for me, it is about community collaboration. It is about community engagement. It is about community cohesion, because as I say, when you talk about us being the workforce being the community and the community being the workforce, those 3 areas are so important. If I could just finish on the organ donation, blood donation, because that's primarily a lot of the work that certainly for the last 6 months we have been heavily involved in. It is so surprising how many people do not understand or do not know how affected we are, certainly as Black people, because of the fact that we are the ones that do not donate blood, or we do not even consider donating our organs. And even more recently, the work that RAFA has undertaken, it's gone out onto the streets, in fact, and just asked those the very question, And again, surprisingly, a lot of people, irrespective of all the campaigns that have happened, are not aware of the fact that the law has changed, not aware of the, you know, the impact on them. So again, I would say that it is important that we engage. It is important that we continue to raise awareness. And I think that, you know, it's important that we do that collectively, because, you know, we can't, it's no point us doing it in isolation. We have to collaborate, we have to communicate, and we have to educate. So that's me in a nutshell. So thank you very much. Thank you.
Okay, thank you very much for that, Angela. I'd now like to go to Patricia Ojo. Patricia, good evening. Let's just unmute you.
Good evening, everyone. Good evening, Rudy. Thank you very much for inviting me. And I must apologize for my late arrival. Rudy may well have told you that I'm actually in the deep end. I'm in a community pharmacy, and we currently run a COVID vaccination clinic. It was intended to be finished before this meeting started, but as real life dictates, it wasn't meant to be that way. So I must apologize for arriving late. I didn't quite get the first part of the meeting, but I think I've got it gathered from the brief that it's an introduction, and then obviously what we're hoping for to achieve in terms of for the community. So is that right?
You could just say something about what you've done in terms of the community pharmacy wellness dialogues,
right? Okay.
What the community pharmacy can do for you, and just the
awareness
and understanding of that for the public.
Right. So probably about a month or two ago now, is it, Rudy?
Yeah, I think so.
Yes.
Go so fast.
We were introduced, and basically it was just to try and get my perspective as a community pharmacist into what we could do and what the community pharmacies do, basically. And I'm quite passionate about a lot of the topics that you've, all of you have talked about, diabetes, and also long-term conditions such as asthma, COPD, etc. But most recently, really, and I think we've, you know, sort of alluded to that already, the impact of coronavirus on our communities, especially. So I have spent quite a lot of time trying to champion the uptake of the vaccine in my little environment in the community pharmacy here, but also just really among people that I know as well. So what I've been doing in the community pharmacy wellness dialogues is really talking on different topics, but also around pregnancy and the COVID vaccination, breastfeeding, as well as, you know, sort of basically preconception as well. We've also touched on some of the things that community pharmacies can do to help some of our elderly in the communities as well. So we basically, in terms of those meetings, it's just raising awareness of the kinds of things that can happen. So I'm going to go into the community pharmacy angle and basically try and pull in together some of the things that you've talked about. So if I look at my role as a community pharmacist, and also being a specialist in diabetes care management and asthma, COPD, etc., diabetes particularly is one of those ones that we know that is very prevalent. And what I do in my day-to-day work is when I see a prescription, I try to interpret it in terms of who that patient is. So what do they look like? And it's really to try and then raise awareness, because we know that in terms of the management of diabetes, with a lot of information, you get some good results. And I have done that. Part of my experience about probably about 5 years ago now was actually in a general practice setting. And that's where I became even more passionate about diabetes and decided to make that one of my specialist areas of practice. And seeing the results that could be turned around. And there was a lot of talk about clinical inertia, and we have a lot of patients that were sitting on the database who really were just very, very poorly controlled. I had to put my hands up and say, is there something that we're doing that was making it poorly managed? And I think, you know, there was an agreement among all of us that actually there was a lot that we could do about that. So it was one of those things where it was bringing in patients with for reviews, etc. And we did see very, very tangible results, and the outcomes were very clear to see. So patient education is absolutely key. without patient education, a lot of the time people are just rolling with what they've got, and actually having seen in practice what we can, sort of help to facilitate patients making changes to lifestyle first and foremost, but also in terms of looking at where medication can be of benefit. What we could definitely show was that bringing those two things together was key to every aspect of managing of the patients. So in my context as a community pharmacist, one of the things that I do is try and use the conversations that I have with the patient to find out what their understanding is, and then use that as a very patient-centered one to try and direct them into how either we can provide them information, either to help them manage themselves or actually to signpost them to the right places. But definitely there's a lot that we can do in community pharmacy to improve the welfare of our patients, especially when it comes to some of these long-term conditions.
Thanks for that, Patricia. And once we're on that point in terms of the importance of the generational contact, the fact that community pharmacies, do have private consultation room, they can just walk in and get the information and advice that they need. So we're back to the community being informed, reassured, so that they can make the choice.
Yeah. So, I mean, if you come into my community pharmacy, and certainly even when I was in a general practice setting, Dr. John was talking about the Diabetes UK. They have a lot of useful information now, and it's really good to see that there are now magazines that you can get, which has got dietary information that relates to the Afro-Caribbean community or the Asian community as well. And those are the things that I make sure that I have available and to hand, because that sometimes is the gateway to actually encouraging someone to realize that they can do something, because it's not about parting with everything that you've always known. It's about how you use the right information to help you make the choices and make it the right way. So the 15 care essentials, again, is a leaflet that I use to empower patients. So you've come in to see me today. I realize that you haven't been for a review for maybe in a couple of years, and I've really dragged you in here. That leaflet tells you exactly what you should be expecting me to do for you and what you should be doing. 8,000 plus hours in a year where you have to manage your diabetes on your own, and you might be lucky to see a clinician like myself for 3 hours of that throughout the course of the year. So there's a lot that the patient can do on their own, and in the setting that I am, it's to try and use whatever is available to try and empower patients to understand what they can do as well.
Thanks for that, Patricia. And we're going to come back to some of those points that you made, particularly around patient and public education. Now I'd like to go to Richard Davis. Richard.
Some of our viewers, my name is Richard Davis. I regard myself as a community activist, a small business advisor, and mentor. I'll say over the last 40 years, most of my work is around involving community engagement, awareness, and trying to get the community more involved in a more holistic as well as more collaborative approach, similar to some of the stuff that Rudy have done over the years, because we tend to cross paths in many ways. But what's the importance of involving this session is more around the work me and Rudy did 18 months or so ago when we discovered this pandemic and its impact is having on our community. And we said, we need to play a key role in this. Because over the years, I know we have a lot of health and social care organizations in our community are doing fantastic work, but there's no join up work among those groups. Some have been going for 30, 40 years. In Manchester here, we also have CAN, which is a Caribbean African Health Network. They, at the moment, at the forefront of the government health and social care agenda. And Manchester is a dissolved authority that actually taking the lead on that. So during the pandemic, we decided to work together from a national platform, and Rudy was very instrumental in working with me on this, to make sure the African Caribbean community have a collective response to the COVID pandemic. And what we did, we have a series, almost every week, we have a series of programs touch on education, touch on health, jobs, and other issues around health and well-being to ensure these organizations, when we put on the Zoom meeting, to a point we become more expert at this, because I was on Zoom non-stop, because we need to be seen, to be engaged, use good practice around the country, and make sure the other African Caribbean communities around the UK, and we live in a global world now. So most of the Zoom call we have people from different parts of the world was actually interacting what was going on in the UK. It was a time, as you are aware, the pandemic was the death rate was very high in the UK, and it impacted heavily on our African Caribbean community. So at the time, we realized that what we started at the start of the pandemic was relevant, and we literally was pushing the agenda out. It was difficult for some of these health and well-being organizations across the UK, because it was like they're protecting their own little areas, even though many times, and Rudy, after we finish, we normally have our pre-meeting to discuss. We need to try to let these organizations know they got the skill and ability to play a key role. And we found out later on with this report that our input was vital to inform the government. This is the best part taken going forward. My background, as I said, is more involved in business as well as involved in community initiative and community development as well. I know we mentioned before about sickle cell. Even though I'm not a medical person, I would say after 38 years of living with somebody in my house who run the second largest sickle cell center in the UK, in Manchester, Verna Davis is my wife. She's been instrumental in the start of the sickle cell organization in Manchester. She will be retiring soon, but we'll be working with her. My daughter, she just actually able to put a large sum of money in my business account by ensuring the NHS in the Northwest invest in mental health first aid. And so now my company, Amazing Business Solution, now we win the contract to facilitate that work, and we're doing it now. And we hope to do the face-to-face later on in the year. So we have the issue of mental health, we have the issue of sickle cell and other health conditions, and with the help of CAN, I know Angela make a link with CAN, and we are saying to organizations like CAN, who are at the forefront of health and social care in the UK, we want to ensure that body is working across the UK. So I'm pushing the agenda from the Manchester perspective, because we have a very good working model. I would want to see it across. That's the type of person I am. And Rudy know, based with this company, make Connects work. I always push the agenda. We need to make sure Connect work across our Black community, UK-wide.
Thank you for that.
I use other vehicles as well through my business network and community network to put on seminars across the various island nations, because in Manchester we have various island nations, and we normally coordinate meeting with them. We work not only within Manchester, we work closely with Liverpool and with Preston and the other major cities across. And we even go across the Yorkshire Moors, Huddersfield, Sheffield, and Leeds and Bradford. They're just only a less than a hour drive from Manchester. I go over there and I invite them to Manchester. So I'm a type of person, a joined-up person, and with my experience in community and health and social care and business, that to me is a good recipe to use every sphere of opportunity and angle to get our community to be involved in the solution. I'm really fed up of sitting back and see people trying to, and we allow them, not to say trying to, we allow them trying to solve our issues. We have the expertise. Just listen to Dr. St. John and others, what Patricia said earlier. It's important that we use our collective skills and strength and to be part of what's going on in the health and well-being sector.
Thank you very much for that, Richard. And as you can tell, everybody, Richard demands collaboration. And I tell you, it's helped quite a lot over the last few months in terms of the endeavours that we've done jointly. I'd now like to invite Dr. Donald Palmer, who again has done a great job over the last few months. Donald.
Thank you, Rudy. I hope folks can hear me.
Yeah, there's a funny sound, but we keep going. Keep going.
Yeah, it's a bit distorted.
Yeah.
So I'm not sure what the problem is. So firstly, I'd like to thank Rudy. I'd like to really thank the panel. I feel both honored and privileged to be amongst such esteemed individuals. And also I'd like to thank everyone for listening. I kind of think I'm maybe I'm a bit of not a fraud, but I sometimes wonder what I'm doing here. The reason being is a bit of background about myself. So I'm a professor. I'm an associate professor of immunology, and I was reflecting on this. You know, two years ago. This is pre-COVID. I was in Copenhagen talking about my immunological research, really to a scientific audience. It was a 2-day conference, 3-day conference. We were just discussing all aspects of immunology. 2 years now, and I have a completely different audience. And I'm really grateful for that, to speak to the community. And it's been a really interesting journey. And part of that is the fact that, you know, prior to COVID, even my family and friends didn't know what I really did. They just thought, oh, he does something at university, and that's
immune system. What's that?
Yeah, and the thing is I want to talk about this in a way where, and I think both Patricia and others have commented on this. And for me, it's really the fact that the many Black professionals have stepped up because there's been this vacuum. Mm-hmm. And I think I've fallen into this category. So how I got involved was December last year. Alton Bell, a pastor in Wembley, approached me and said, Donald, look, there's discussion going on. Looks like there may be a potential vaccine, but overall, it'd be useful for our community to just be aware of the general science around COVID, just to understand what it is. Mm-hmm. And that's literally how I started. Mm-hmm. And being an immunologist, I've always said this, and I've subsequently done over 60 of these events. It's just remarkable. And part of that is around, and it's something Angela says, and Dr. St. John, it's about creating awareness and understanding for the community. And subsequently, while I realized I was having this discussion and talking to our community about what is COVID, what is the immune system, what is vaccination, and I just kept it in general terms. Mm-hmm. I wasn't actually even being pro-vaccine. I just kept it really so that one can make an informed decision. And it's what Dr. St. John said, there's this gap and lack of awareness. And that's why I'm really grateful. The organizations that Richard mentioned, CAHN, really, and many of us stepped up to fill that void. Because when the government started to roll out the vaccine in January, there was really no specific public messaging for the Black and brown community. And at that time, there was quite clear evidence of legitimate concern that the community wanted to discuss, wanted to be heard, and was clear that that discussion needed to take place.
Well, the only message was that there was hesitancy,
yeah,
particularly amongst the African and Caribbean population group. And linked to that was the underutilization and overlooking of the professional workforce and the scientists within that community.
Yeah, and it's about, you're right, and it's about trusted voices. So what
community and workforce, yeah.
Yeah, and it was a case, these were legitimate concerns, and partly what it related to was just a lot of misinformation, which was seizing on those legitimate concerns.
And the trusted messengers. I mean,
Yeah, and so
the
when
key
trusted
theme of
messengers,
all
and
this has been about the trusted messengers. And,
exactly. So many of you here that's been involved in this.
yeah.
I remember one of the early ones I did, and that's how I met Dr. St. John, was we were on an event in Brent, I remember, like in January, where about, I think 500 people was on this webinar, clearly wanting just to
Understand.
questions.
Yeah.
There weren't an opportunity to ask questions.
Mm.
And subsequently, I remember listening to the questions about the vaccine, about does it alter your DNA, etc., etc. These weren't silly questions. These were questions that are permeated into our community, misinformation. And naturally, people wanted to know. And so one of the things I did with two other individuals, that's Dr. Jackie McLeod and Terence Channer, we realized there was actually no information booklet, very similar to and inspired by Dr. St. John. So we produced just a 2-page document around, frequently asked questions about COVID, vaccination, and the disease. We produced a 2-page document, and we asked faith leaders, what do you think of this? They said, fantastic, we would like to have one, because by then, the Catholic Church, imams, the Muslim community had already started to produce such booklets. Yeah. But there wasn't really anything for Black majority churches. There was this void. So we produced this. And in the end, I'm aware even councils took up this leaflet, put it on their website so that they could provide information. So that for me is really, and I'll stop there, it's really that us as professionals can provide folks, like what Patricia's doing, a fantastic, entity. It's about providing our community with the appropriate information so they can make informed choices. And I'm really grateful that we've all sort of stepped up, and I'm grateful to be involved, in that public awareness. Thank you.
Thanks a lot for that, Donald. And it's interesting as well, and Patrick touched on it as well, is that when we think about the workforce in terms of the African and Caribbean populations groups and the networks and the clinical networks that they're part of, yes, it's about career progression. So increasingly now, post-pandemic, the public will have a greater say, I believe, in terms of, when I say the public, I'm talking about the community, because they are part of the community. Our workforce is part of the community. So it's not just going to be about their career progression within the NHS and its related agencies. It's going to be about their thinking about the improvement in terms of quality and service improvement to the community, and thinking about the well-being and morale of the community as well. And of course, community engagement. And for many years, those of us who work within the system and have helped facilitate and set up these networks, we said it's important to have community engagement. And Angela was very clear in terms of the kind of work that RAFA's had to do. And that's why even with our community pharmacists, they've been open all the way through the pandemic. But at the end of the day, they themselves also have to outreach into the community, because that's the way provision works. We have to go into the communities. We have to get them involved. Now, the pandemic has also shown that the lack of representation all over the system, but then you can't get representation unless our community is involved. So it goes back to Richard's point about collective responsibility. We have this collective responsibility to get involved and to collaborate. So the pandemic has shown us and uncovered the way forward, and that's why we now talk about shaping our futures. So in the last few moments that we've got, I'm just going to go around to all of you, and just to give us a couple of key points based on these thoughts, and in terms of what are your thoughts and plans post-pandemic with regards to self-care, economic well-being, community wellness, professional collaboration, and public health information, which you've all touched on. But again, as we know, when we're dealing with the public, You know, we've got to give short, sharp messages like we use through the vaccine confidence dialogues and wellness. We've used informed, reassurance, and choice. So I'm going to go back to Patrick first. You're on mute, Patrick.
Right. Thank you again. After so much very interesting conversation from so many different perspectives, I feel really honored. But I do believe going forward, it shows, in this panel as well, show clearly the importance of communication, good quality communication. And if you don't have good communication when it's needed, a void appears, and that void really is filled with others that not so positive. So it's important to understand the conversation, and also things like what you do, Rudy, is bringing panels of people together to share knowledge, to share experiences. Because one thing I really came across what I was talking about, I picked up with Joe St. John's, right? With her work with diabetes. Well, basically most of the issues that she faces is similar to with sickle cell, and in fact most specialized diseases. And that is just lack of awareness, lack of knowledge, especially in sickle cell, right? And communicating meaningfully with a patient group and a community like sickle cell community. Those are the things that needs to improve, okay? And how we could do that, because now there is people looking for information because of this thing. So we have got to really produce more platform like yourself and others with people that has got really a good record, and community leaders as well as clinicians, as well as researchers, you know, because we want to know what's going on in research. I'm talking about Dr. Donald Palmer, the work he's done now is come to the forefront. Now he's got to build on that, and hope he's doing that. And that's what I think going forward, what I take from this, and I want to see more happening.
Great points, Patrick, the professional collaboration, because all the skills and knowledge are within our community. Our communities are working in the health system. So it's no use us saying the NHS needs to engage with our community when we've got 40% of our working population working in the NHS. And this is what the pandemic has uncovered, and actually giving us an opportunity to address that in our lifetime. And I've been around 20 years doing this work. And this is the pandemic just in the last year, really, that's enabled a lot of these joint platforms and collaboration to happen. Right, I'm going to go to Joan.
Before you go, could I have a personal note, please, Rudy? Is Richard Davis. Richard, I've worked with your wife many times. I've never met you before, so it's great to meet you finally. And she can't retire because she got too much knowledge and experience. She really can't.
I think, can I just answer briefly? I think Werner been doing this job for nearly 38 years. But what I'm hoping to do, Patrick, is to reassure you guys that with the work I'm doing through my company, as you can see, I already get my daughter on board in driving the mental health first aid program, is to get Werner come on as a consultant and make sure that skill, knowledge, and base remain within the wider community. Because you're right, in one way, she may be leaving the NHS, but want to make sure that knowledge and wealth of experience remains.
That's great.
In our community.
At least that knowledge will be lost. Felt to get in touch.
We can rest assured that Rudy knows me. I'm a community activist, and I want to make sure anything related to health and well-being, we need to be forefront, and we need to make sure that knowledge base is there. And that's why organization like CAN, as I mentioned before, I want to see a replication of that organization where we have a strong health and social care agenda, which is an umbrella organization to drive it across our major city, because we got so much good organization that doing fantastic work, but there's no join up work when we talk about bidding for contract through the commission process and so forth. So we need to have the coordinated approach. And that is where I'm a person would not let it go. I will make sure we fight to make sure those organizations come together and join up together, a similar approach as we did with CAN in Manchester.
Tell her to get involved with me, to get in touch with me. We've been talking for too many years.
Okay, I will.
Okay, bye-bye.
I'll make sure they get your numbers. Right, Joan.
Thanks very much. I'm going to have to talk really quickly because there's so much to say. So I have just put in the chat. Rudy said I could do that.
Yeah.
I'm trying to walk my talk. I like to call him Professor Donald Palmer. Okay. I think he should be a professor.
Absolutely.
Anyway, Professor Donald Palmer and I started on this journey similar time. And I think, you know, from tragedy can come better things, we hope, because otherwise we get crushed by the tragedy. So I decided that really, along with so many fantastic experts, as you see here tonight, that we have to get together and do what we can to improve our collective health. So I'm trying to walk my talk. And one of the ways I'm trying to do that is, as well as being parts of panels, I'm also doing a series of webinars, trying to raise awareness. Angela, you mentioned pre-diabetes. As it happens, tomorrow night is about how to know if you've got pre-diabetes and how to not even get to a situation where you have pre-diabetes. We want people to be as healthy as possible. So, as I say, there's so much to say, but, you know, I feel it's about collective work. Yes, collective work as a community, because I don't think you can separate healthcare professionals or providers and the community. I think it's got to be a partnership, and that's the way we're going to best move forward. I also think the genie's out of the bottle. The trusted messengers, the experts, you know, Professor Palmer, so many others who have come to the fore. We have to use the expertise. We have to use the knowledge. We have to empower ourselves, and we have to make sure we have better health, because other crises may come. And I want us as a community to be better prepared in terms of being in better health should other crises appear. With regards to sickle cell, I also heard that Lola Oni is from, you know, from Brent.
Yeah.
Because I've been involved in the Sickle Cell Society as well, is retiring. So we cannot afford to let our wonderful experts, professionals, and brilliant people from the sickle cell community all retire at the same time. So I'm with Patrick. I'm afraid, Richard, your wife can't retire yet, or somehow we've got to get together and make sure that expertise isn't lost.
In
Collective is the way we go forward. I'll stop there.
Right. I'm glad you mentioned that, because I was fortunate to work on some NHS London programs. So I worked on and Patrick would know this because that's one of the first places that we worked. In the old days, we had the Patient and Public Advisory Group, NHS Healthcare for London. And that was in the days with the stroke and trauma units across the capital and the reorganisation of them. But since that, we've got a body called the London Clinical Senate, and there's a patient and public voice relating to that. And Donald would know this from a previous Reed Society meeting, that a few years ago we spoke about the importance of our community having some kind of Senate, because the way the Senate works, the clinical Senate works, you have a body of people with the knowledge, and if there's going to be any changes or any thoughts of service and quality improvement, those ideas go to the clinical Senate and people have their input, and just give the benefit of their experience. So again, we do see, again, we are going to see this opportunity to have a clinical senate out of the body of people that we're now working with. So I'm just saying that I wasn't going to announce it yet, but as you said that, Joan, you know, I've said it. So, and that's why we are thinking very clearly about the future. And coming over to Patricia now, one of the other important things around the community pharmacy, particularly across the capital, we have a number of very good African and Caribbean community pharmacists with all different types of background. And they're there again to give the community, those population groups, the assurance. The community sees them as trusted messengers. They have the cultural understanding, and now there's going to be a collective of community pharmacies connected to other parts of the workforce system, and again, that's going to make a big difference to the quality of services. So Patricia, over to you. You need to unmute first, though.
Yeah, so I think in terms of what everyone said already, it's quite important that we do make those sort of efforts to collaborate a little bit more. I always try and look at this from the context of where I am in the community pharmacy, and I know historically we tend to be quite chained to what we're doing, and because we have, you know, sort of contractual hours, it can be very, very difficult to do things within the context of when we're in the premises. However, I think, you know, if I have anything to say, it will be to encourage myself and my colleagues as well to look for the opportunities to try and engage a little bit more. And I know I was chatting to you about this, Rudy, you know, you want to do it, and then you realize that you've got the confines of having to be in the premises, etc., and you don't necessarily have a backfill easily. So it's very difficult sometimes to do certain things during certain hours of the day. You know, half an hour towards the end of my day when I'm going to be closing, it's not so difficult. So it's really, really good to maybe bear that in mind for those of us who are in here. I certainly always look for opportunities to encourage my colleagues as well, because I know there's a lot of knowledge there. I specialize in a couple of long-term conditions and anticoagulation, but I have friends who are either HIV or substance misuse, etc. And, you know, thinking about the effects of the pandemic, you know, especially for the younger people, when, you know, we have to see them, it's become much more clearer, having prepared to vaccinate younger children, how the safeguarding of those younger people and the effects of the pandemic on them is really, really much more acute now. So for me, that's one of the take-home messages, is to collaborate with people like yourselves a bit more, know what's going on out there, bring that into what I do from day to day, because what I've always had in terms of feedback from patients is that they didn't know and they didn't realize, and how useful and how helpful it has been to actually walk in to see somebody that they see day in, day out, talk to them about something that they've had a concern about but never felt able to talk about. So it certainly is a take-home message for me, and definitely collaborating and looking for opportunities to actually go out there and let you yourselves, actually, who run a lot of these you know, sort of groups and outreach programs, know what we can do within the community pharmacy. And certainly don't hesitate to ask us, you know, when you need to collaborate with you as well.
Yeah, and what is great now, we now have a group of community pharmacists from our community who are now, you know, getting used to being on these platforms and sharing their knowledge with other colleagues, and you know, including public health as well, and of course speaking direct to the consumer in this kind of setting. This is still a new setting for all of us. And the other important point in terms of Patricia's work, having a clinical background as a former nurse, and if you think of the concern at the moment in terms of unvaccinated people, women, pregnant women, so again, being able to give women the information reassure them so that they can make the choice when it comes to fertility, when it comes to pregnancy and breastfeeding, that they get the right information and able to counter the misinformation, which is at the end of the day really important for what we're doing. So Richard and Donald, you got a very short time, so I'm telling you ahead of time. Richard.
Yeah, can you hear me?
Yeah.
Yeah, guys. Yeah, I just want to follow up on what I said earlier. Collaboration, no matter what we are to call it, partnership, is so vitally important. And we discover during the pandemic, as a community, we have so many skilled people, both the social and the health sector. And some of us are retiring, as we talk about, including my wife. How can we be able to create a sustainable program to make sure those wealth and experience maintain in our community? Because the pandemic is a demonstration of the impact it's having on our community. The question is, are we, as a community, prepare for that? And how can we deal with a similar pandemic? Not to wish on anyone, because this one to me is, as it were, it may be for a lifetime, but we want to make sure the generation to come to say, listen, we are ready. We have the institution, the organizations. Are we going to leave it to other people to do it for us?
Exactly.
And we need to be more engaging across the various sector, across the country. We have a good organization in Manchester here and some very good people who can work, people like myself who are prepared to travel across the UK and across around the world. I was in South Africa and other places and was actually put a message out there. Other people can do it. Now we have social media platforms as we are now. We don't have to travel that distance. We can use it more effectively to get the message out there and get things done.
Okay, thanks, Richard. Donald, and then I'm going to go to Zishan to have the last word on behalf of NHS BT.
Yeah, thank you, Rudy, and again, brilliant discussion, and again, thank you for your kind words. I've written a couple of things so I can really be focused.
Please.
And I think what you said is this: all the skills and knowledge is in our community, and I think I have incredible faith with the progression in our community. I should point out, you mentioned Reach Society, that's an organization of Black professional role models, and we're having similar conversation. We've set up a group called the Smart Health Project. Go on our website, have a look. But the reason why I'm confident is the generation that's coming up are amazing. Because there's an organization, and perhaps Patricia knows, they call themselves Black Farmer, group of Black pharmacists, students that are trying to get representation, increase knowledge. There's another organization called Black in Immuno. It's mostly US based, but they also have some young Black immunologists. Again, increasing awareness around that field. There's Black in Neuro. Again, groups of young Black people coming together to understand the whole aspect of the nervous system and pain. So I think I have great optimism that the skill set will be far greater in our community, as long as there can be greater communication with the community as a whole. I see us going forward, and I'll stop there. But thank you again.
All right, thanks for that, Donald. Just before I come to you, Zishan, I just have to say, Dr. Beverly Lindsay would have been on this platform, but unfortunately she had to attend another meeting, and she would have spoken about there's 4 pilots around the country at the moment in terms of mental health. It's called the Patient and Carers Race Equality Framework. So that's Manchester, Birmingham, and 2 pilots in London at SLAM and Croydon. So I'm involved with the Birmingham and Solihull one with Beresford Dawkins, who works with Birmingham Solihull Mental Health Trust. And there's some good work going on there in terms of thinking about how can we improve the community's response to mental health in terms of prevention. and when our community do need to enter the mental health system, what support can the community give? And that's becoming quite encouraging, some of the work coming out of that, because we're looking at the environment, and I think it was Joan at the beginning was speaking about the environment. Patrick touched on it as well. So, you know, utilizing again the community assets, you know, the barbers, the hairdressers, our churches. These are the places where people feel safe. There's a safe environment, and they can share their information. And it has to be said that, again, in terms of Donald mentioned, our churches, particularly Pentecostal churches, Church of God of Prophecy, you know, they've been involved in the vaccine program. You know, they've hosted teams, they've integrated the messaging into the services, and we've had quite a few bishops all around the country from different denominations from within the African and Caribbean population groups who have been involved, and all of these do make an impact. And of course, we've had nurses at the forefront. Jennifer Pearson is on here as well in terms of working in Birmingham, done a lot of work with Donald as well. So, you know, we've got a lot to be proud of, but there's a lot more we've got to do. So the only thing I've got to say, that, and you would have heard this, many of you, there's an old saying that says, the best time to plant a tree is 20 years ago. The second best time is today. So hopefully that's what we're doing now. Zishan, are you there? Final word with you.
Yeah, thank you, Rudy. And just to reiterate my thanks to the panel, and really fascinating insights and conversation, and you know, I feel incredibly proud that, you know, we have champions like yourselves who are championing our causes on our behalf and helping to improve the health for all our sort of ethnic minority communities. So really, from me, really grateful for all the work you do, and just wanted to reiterate my thanks again, and look forward to continued collaboration with the NHS, especially NHS Blood and Transplant too, which I know you all work closely with too. So thank you once again, and thank you for joining.
Thank you very much, and good night all. I should just say that we will be rebroadcasting this show on Fresh FM Radio London, and of course it will be shared in all the WhatsApp groups and YouTube and everywhere. Thank you and good night.
Thank you.
Thank you.
Thank you, everyone. Thank you again, Rudy, and everyone. Real pleasure to see you all. Take care, and good night.
Good night.
Good night.
Night.